Hey, hi everyone. Okay, hi guys. So my name is Riley, and I'm going to be doing a parent consultation today about 6-year-old Liv. She has hearing loss, and I'm going to be recommending some AAC devices, including a cochlear implant. So to begin, this is just some background on Liv for you guys. So she's 6 years old. She's in first grade. She was born with profound to severe hearing loss in her left ear, which, if you're unfamiliar with hearing loss, that's the most severe type, and mild to severe hearing loss in her right ear. So she is deaf or hard of hearing. She currently fully communicates with American Sign Language, but she also relies on facial expressions and gestures. And as I said, I'm recommending her a cochlear implant. So, does anyone know anything about oral rehab? No? Okay, so I have this video. I'm just going to show a little bit of it, but it kind of just defines what oral rehab is because that is what Liv is currently in for speech therapy services.
My name's Amanda Fitz, and I'm an oral rehabilitation audiologist here at Cincinnati Children's Hospital. Oral rehabilitation is a type of therapy that is for children with hearing loss to assist them in the development of their auditory or listening skills. It's sometimes referred to as auditory training or listening therapy. Children are typically referred for an oral rehabilitation evaluation once they've been identified with a hearing loss. Their managing audiologist would inform the family of the hearing loss, go ahead and fit them with some type of amplification, whether it be hearing aids or a cochlear implant or some type of an assisted listening device. And then the child would be referred for an evaluation of their auditory skills.
Okay, so that is just kind of a brief overview of what it is. Does anyone have any questions regarding that? Okay. Okay, so first, I just want to know if you guys have any questions regarding Liv and her current services that she receives or just her hearing loss in general. If not, it's okay. Okay. Okay, so today we're just gonna, as we did, went over oral rehab. We're gonna discuss Liv's future, the goals with Liv, discuss treatment options, cochlear implants and other options related to that, ways to support Liv at home, and then some additional resources for you guys as the caregivers and parents. Okay. So, not everything is loading. I have another diagram there, but that's okay. So, children born with hearing loss often have speech delays due to their loss of hearing. It can kind of differ from patient to patient, child to child on what their speech impediment or speech delay consists of. But oral rehabilitation's goal is to aid in their hearing loss while also assisting with their speech as well. And then this link is just a link to ASHA's website of everything that has to do with oral rehab and different services and treatments. So if you're curious about that, that's a great resource to use. Okay, so these are some goals for Liv. She's currently working on visual speech therapy cues, which is basically just being able to communicate, reading lips, using facial gestures, and using facial expressions. Children that are deaf or hard of hearing, their senses with their vision and their smell and just being able to pick up on emotions is very advanced due to them having a hearing loss, and it kind of gets made up for in different areas. As I said, her main point of communication is ASL, and she currently suffers from communication breakdown moments. Has anyone ever heard of those? Yeah, okay. So basically, if you haven't heard of those before, it can be a cause of many different disabilities that children have. But when it comes to hearing loss, if Liv or any child that has hearing loss can't get across what they're trying to communicate or don't understand what's being communicated to them, it can kind of cause them to have a meltdown. And a lot of times, children that use ASL or lip reading, they'll just kind of shut down, not use it. They don't want to be a part of it. They don't want to have speech anymore or speech therapy, and they just kind of shut down completely. So, this is very common, just like any other child. Every children has meltdowns, and it can be a little more severe when they can't communicate properly. That can be very frustrating. So as an SLP, my goal for Liv is to be able to be so confident in her communication that she's able to distinct certain sounds and also work through these communication breakdowns. So just finding a method that really works for her, whether that be we just use ASL when she's struggling to communicate, or we add a new AAC device to kind of help her work through these moments. And then, do you guys have any goals for Liv? It's okay if not. Perfect. And then I just like this image. So I'll kind of touch base on AAC devices later too, but if you don't know what it is, it's an alternative augmentative communication. So a lot of times it will just be like a big iPad with a ton of pictures on it, and it will have like a happy face, sad face, different types of foods, different colors, and the child can point to it. And that's kind of how you can know what they want or what they want to tell you. And I just like this quote that it's never too early or too late to start AAC, because even though she currently uses facial gestures, lip reading, and facial expressions as her AAC, it doesn't mean that we can ever take one of those away or add something new. Okay, so as I said, AAC devices, augmentative or alternative augmentative communication. So Liv currently uses, it's not loading properly. I have different images here. I don't know why it's not loading, but she currently uses facial gestures. And then this is just an example of a communication card that just has very basic things like yes, no, if she is ill or like wants to communicate how she feels, just different facials. But for Liv, I would recommend this communication board up here. I think that for her age, it would work very well and might help work through these communication breakdowns that she has. Okay, so what I'm recommending is a cochlear implant, and this is due to her extent of her hearing loss and her struggling to communicate and distinguish sounds. Because of all of this, she would be a great candidate, and it would benefit her and overall enhance her overall quality of life. So I'm gonna show you a quick video, and this video just kind of emphasizes what life is like for Liv when it comes to trying to read lips and just kind of what it might look like to have hearing loss.
So when I was really young, probably kindergarten or first grade, I have a much older brother, and we'd go out to recess, and there was this older guy. He might have been in like fifth or sixth grade that always used to pick on us, and I didn't really know what to do about it. And I definitely looked up and completely trusted what my dad
Today we went to a high school and
I was posing for a picture with all of my girlfriends, when all of a sudden one of them leaned forward.
Can you read my lips?
Can you read
My lips.
Can
you-
you read? Can you read my lips? Can you read her lips?
my God, Clementine loves bread. She stole a little pocket.
Can you read his lips?
I have two dogs, one boxer, she's 7.5, one mixed breed, who's 8. I am deaf, but my word is a hearing one. I rely on the visual, not the auditory. The word lip reading implies reading, like reading a book
whose text is legible and clear.
But the human face isn't a book, and lip reading isn't reading. People mumble, people talk fast and laugh loudly, people have facial hair like porcupines, lips like sphincters, people cover their mouths, people have accents. But real conversations don't take place in a studio.
Okay, so that video, I just like the beginning of it because I think it really emphasizes kind of what life is like when you have hearing loss. And the benefits of using a cochlear implant will get touch base in the next slide. But does anyone have anything to add after watching that video? Okay. Okay, so why a cochlear implant? So Liv was born with severe hearing loss, and due to this, her ways of communicating are very limited. A cochlear implant would allow her to hear in a way that she's never been able to before. I do want to emphasize that a cochlear implant is just like another hearing aid device. However, it's surgically implanted and it does not restore her hearing. So she wouldn't be able to hear like we are able to hear, but it is going to bring her severe to profound hearing loss to more of like a mild hearing loss. So she'll be able to distinguish sounds and also hear her own voice and her own vocal tone, which will improve her speech and her articulation. And then, sorry. Okay, then this is just a very short video that kind of shows a child with a cochlear implant.
Sheep, lion.
And then you can also see this is kind of what a cochlear implant would look like. So they would surgically put almost like a magnet type thing in their head, and then this can all come off whenever they want it to come off, but the magnet would be in their head. Okay, so this is just a diagram that kind of shows some better outcomes for a cochlear implant. It is a very routine surgery, and there's not a lot of complications that can occur during the surgery, but these are just some ways that you can ensure that it is the best experience for everyone involved. So having an audiological team before, and then an experienced surgeon, having a great rehab team. So this does include a speech therapist and a language development, which kind of goes in hand with a speech therapist. And then going to a hospital that you trust and that you know has the proper equipment and training to do a cochlear implant surgery. Okay, so you might not know what a cochlear implant is. It is a device that provides sound to those with severe, profound hearing loss. Benefits of a cochlear implant include enhanced overall quality of life due to being able to distinguish sounds like never before, working on their own individual vocal tone, enhanced communication skills, and also increase live safety levels because she currently can't hear any of her surroundings. So this just overall increases her safety levels. But there are some cons, so there can be unknown side effects. It kind of can depend patient to patient. Loss of residual hearing. Does anyone know what residual hearing is? Okay, so if you don't know what it is, it's basically just all the natural sounds that Liv can hear with her hearing loss. So there are some sounds that she can still identify and hear. And then sounds can be overwhelming as well. So there was this documentary that I watched, and basically when you have hearing loss, you're not familiar with all the sounds that we take for granted every day. So a patient received a cochlear implant and they became very overwhelmed in the grocery store and actually had to take off their cochlear implant and didn't use it for about 2 months because we don't really think of all the footsteps that we hear and the air conditioning and people picking up different boxes and all the little sounds. For someone that has never heard that before, it can be extremely overwhelming for them. Does anyone have anything to comment or add or questions yet?
So with the implant, obviously child is very young and they're gonna grow. And so as they grow, is this something where as upkeep will you have to replace the implant or kind of how does it look moving forward through the rest of their life?
Yeah, so once they have the magnet that is surgically implanted, that will never change. But for the cochlear implant device, that just kind of depends patient to patient. But they will just continue going to see an audiologist for like kind of how we go to our annual checkups. They'll just keep going, and if they need it refit, it can be refit for them, and it should all be covered by insurance.
Great, that was my second question was how
Okay.
expensive is all of this?
Yes, so I think my next slide actually, yep, okay, so this will kind of touch base on that. So it is a little pricey, as you can see, $50,000 to $100,000. It ranges from anywhere from there. However, it is 90% of the time going to be fully covered by insurance, Medicaid, or Medicare. However, there is that like 10% that will only be partially covered. However, audiologists and speech language pathologists are on your side. They're going to really advocate for you. They'll write letters to insurance, to Medicaid, to Medicare to really make sure that can fully cover their insurance and the procedure. And then this cost also includes everything. So it includes the actual surgery, all the rehab that comes after and before, and all the consultations. Anyone have questions regarding any of that? Okay. And then, yes, as I said before, it doesn't restore the hearing to normal, and then just what the surgery consists of. But there are other options if you decide not to go forward with the cochlear implant. You can continue with ASL. We can really focus and emphasize on facial gestures and lip reading, but as we saw in that video, lip reading can be a little difficult. There are other hearing aids, however, cochlear implant is the best option for Liv due to her extent of her hearing loss. It's just going to give her the best results. And then utilizing a communication board more frequently. Okay, so this is a decision that's going to take time. Everyone is different if they decide to go forward with the procedure or not, but it's nothing that you can kind of make overnight. You really have to think about it and also take Liv and her personality into consideration when making this decision. And then these are some ways to support Liv. So using visuals whenever possible, having pictures, having charts, using her favorite cartoon characters. Focus on the positives and being patient. It's okay to walk away during communication breakdowns. It's not going to be helpful if you're also getting equally as worked up as Liv is, so it's okay to walk away. Using gestures and facial expressions while you're using ASL, so kind of using them at the same time. Music would help a ton. That can help a lot of patients calm down because of the vibrations. And then reading books with pictures. This is something a lot of people actually don't know is a great way to support children that are hard of hearing, but they love just kind of watching your lips, watching you lip read and also looking at all the pictures. And then a parent is the best advocate for children with hearing loss. I just like that little image. And then these are a ton of resources. These are all just great articles. There's also parent support groups that are amazing because a lot of parents that have children with hearing loss, they personally don't have hearing loss and they might not have no history of hearing loss in their family. And so it can kind of be like a denial stage at first. So it's a great thing to kind of get involved with. And then these are just some questions for you guys. If you have any other questions regarding a cochlear implant, you can ask me too. But I just kind of want to know your personal opinion. If you had a child born with hearing loss, would you go through with a cochlear implant? Would you have done a cochlear implant at birth? Just kind of where you're at with all of that.
I would probably do a cochlear implant for my child, just because I really want them to be able to experience the world like we do. And I don't ever want them to feel like left out or like insecure. So I would try to find the way to get them a cochlear implant.
For me personally, I think I would get to maybe Liv's age and then do a cochlear implant just because I feel like them like growing up in a world where they have something that's special to them and they can learn that ASL is important and there's a culture within that and they feel comfortable like with or without a cochlear implant. And also where they get to an age where they can kind of understand it and it's like it is your choice. These are your options. Like I know you would like to maybe hear better, but if you don't, that's completely up to you. Just having that talk with them and also having them know that like no matter what, like they are special and they have a say in what happens to them.
Yeah.
Yeah, I'd probably be there. I'd want to wait until the child, whoever this imaginary baby is that I have, is able to kind of understand the extent of everything that's happening.
Mhm.
Because you never know, depending on who, this child is, they might prefer it to not be.
Yeah. Yeah. Okay, well, if anyone has any other questions, that's all I have. Thank you.